Hello, my name is Nathan Mai. I will be presenting the Von Willebrand Disease. This for my signature assignment for Dr. Haslow's class. So, Von Willebrand disease is a blood disorder. It is one of the most common. It's genetically inherited. It occurs when there's a defect in the von Willebrand factor, which is a multimeric glycoprotein. This defect causes platelets to not stick as well, causing issues with blood clotting. So, like I said, broken cells. VWD targets the red and white blood cells. Normally, VWF, von Willebrand factor, lies in the plasma of your blood cells. They're like glue. It helps the platelets stick to blood clots. It's kind of like an adhesive. This disease causes where there's not an adequate supply of the von Wille factor in the plasma, making it take a little longer to form clots. As you guys can see on the right, when there's normal platelets stick together, when there's normal bleeding stops, it'll stop like that. With the tear, the clot, and the platelets. When it comes to VWD, however, the platelets don't stick together as they should, causing the tear to not fill up. You know what I mean. Generational passing. So how does von Willebrand disease pass? It's genetically inherited by an N gene in the von Willebrand factor. This is an autosomal dominant, which means it's the most common. If inherited by both parents, it will be autosomal recessive, which is the most severe version. Autosomal recessive patients are going to be categorized as type 2 and type 3, which are the more severe cases of VWD. There's a 50% chance that this disease is passed on by a mutated parent. Okay, so look, there are three different types of VWD. There's type 1, type 2, and type 3. Type 1 is the most common version. 85% of patients are diagnosed with type 1. And then here, people suffer low levels of VWF and low levels of factor VIII, which is another blood clotting protein. In type 2, however, it's split up. It gets a little more complicated. It's split into four different categories. There are four subtypes, 2A, 2B, 2M, and 2N. They all have different symptoms and different ways that they don't work. So in type 2A, the body does produce enough VWF. The problem is that it's not correctly sized, so it doesn't fit. In 2B, we see the body created at the wrong time, so it'll create it when there's no injury, thus when there is an injury, the body is not there to produce it because it gets rid of it. In 2M, we see that it doesn't even attach itself, where it won't even bond to the platelets. It'll just be there to be there. And then finally in 2N, we see the VWF not even bond to another protein, which is the factor VIII, which helps the blood clotting. Um, so when it doesn't bond to the factor VIII, the F8, this causes the body to get rid of the F8 protein, which is essential in blood clotting. They both work together as like a tag team. Think of it like Batman and Robin. And then finally, we have type 3. This is the most severe case. This is where the body produces little to no VWF or factor VIII. This means that the body is producing minimal levels, which causes a huge problem. Only 3% of this one do have this type 3. That's because you would have to be recessive when it'll be the 2 recessive in order to create that. So for instance, in type 1, you see low levels, but in type 3, you see minimal levels, almost zero. So let's get into the pathophysiology of VMDB. Like I said, this disease is caused when the VWF gene is mutated. Since this is the case, patients experience prolonged bleeding episodes, so nosebleeds in particular can take up to 10 minutes to fully stop. This may cause packing with gauze, or even in some cases, cautery. Also, easing bruising occurs even without injury. And then when you have the bruise, it'll have like a raised lump. Instead of it being flat, it'll have a raised lump. So how does this affect homeostasis? The mutated VWF contains low amounts of F8. This plasma glycoprotein is important to maintain homeostasis because it acts as an adhesive to sites of injury. So obviously, if you get hurt and you have VWF, it takes longer to heal, and it'll take longer for bleeding to stop. This affects the chemical regulation since it's a defect in the blood, and it's a defect in the gene of the VWF. So diagnosis. There are a couple ways to diagnose if you have VWD. Complete blood count test. This will do complete blood count test. This will do a complete blood count check on both white and red blood cells. Prothrombin time and partial thromblastin time. This also check for blood clotting factors such as the F8 and the VWF. It also does a blood count as well. Or finally, there's a VWF antigen activity, and this will test the amount of VWF in your body, and this will determine, if you have type 3 or type 1. Unfortunately, there is no cure for von Willebrand disease. However, there are multiple treatment avenues. Some of them include desmopressin, replacement therapies, oral contraceptives, clot stabilizing medications. As you guys see on the right in the diagram, it'll show like nosebleeding. See, like it says, nosebleeds per month, doesn't stop within 10 minutes, excessive bleeding from injuries or surgery, easy bruising or lumpy bruises, heavy or long menstrual cycles, and bleeding in the joints or muscles. That's in the more severe cases. I did want to focus on desmopressin. Desmopressin is a drug to create more an adhesive, so it affects the defect with the adhesion of platelets. It is used to treat all three types of VWD. However, with every good thing, there's always some side effects. So some of the side effects include low levels of sodium in the body, headaches, swelling, seizures, and severe weakness. So who is getting affected by VWD? VWD is the most common blood disorder in the United States. It affects 1% of America, 1% of people in the United States. Um, so I believe it is 1 in every 10,000 people have VWD. Globally, von Willebrand disease affects an estimated 23 to 110 people in 1 million people. So it's not as common as you might think it is. VWD is also incurable and is a lifelong disease, like I said earlier. So how severe it is? Before I get into how severe it is, I did want to also mention that it doesn't target a particular race or gender, but it is more Caucasian. It is more common in the people of Caucasian descent, as you see in the graph on to the right. The legend didn't really copy well, so I'm going to explain it to you. The bars describe different ethnic groups, and it'll be divided into three, which is going to be type 1, type 2, and type 3. Um, and the green bar is represented by the Caucasian population, so as you can see, it leaves the majority of it. So there's no severe difference in day-to-day life with someone affected by VWD. People with type 1 and 2 can live life normally, but they do need to be wary of surgery and dental procedures and traumatic injuries. Of course, they want to stay away from those. Um, However, patients with type 2 and type 3 can be at serious risk with major injuries. So I know people with type 3 aren't supposed to be playing sports or anything like that, just because any minor injury can be becoming severe, um, obviously with the blood flowing through the tissues and stuff. Here are some of the references I have for the von Willebrand disease. Thank you for listening to my program and my presentation.